I am Deja May. I'm one of the treatment coordinators here with Leonie and Vaughn. And when we're talking about OrthoPulse, the biggest thing for me is not just telling our patients that it's going to speed up their treatment. It's also kind of discussing how it works for us on the back end and how it makes sure that we are facilitating ideal tracking of difficult movements so that we're not trying 3 or 4 times or doing multiple refinements to get to the outcome that we want. We can ensure that in a timely manner, the OrthoPulse is going to make sure that the teeth are moving in the more predictable way that we can expect the desired outcome that we're looking for. And I do use the topic of it speeding up treatment as a beneficial thing, and I use myself as an example because I've been in treatment for about 6 months and I've gotten drastic change from the beginning to where I am now because of how much I use my OrthoPulse.
And do you show that to your patients?
Yeah, I show them my ClinCheck actually, because it'll show them where the little blue and black dots are. I tell them what that means in terms of areas of difficulty moving the teeth. And so I show them that I've got a bunch of them and it's not impossible, but it just facilitates better and more efficient, predictable movements with the red light therapy than it would without it.
And you decide to go with braces instead?
I did. I did. I knew I wasn't going to be compliant. I didn't want to be a bad patient.
But you still show the ClinCheck, so they can see the difficulty. Okay, you had an open bite and a lot of spaces.
Yeah, lots of space. Edge to edge, yeah.
So do the patient, when you describe it, do they have a hard time justify the cost of adjunction cost of using OrthoPulse?
Yes and no. I feel like for everybody it's a little different. It's all about like kind of, that's a hard question, I guess. For some people that cost is 100% worth it, even if it's going from 12 months to 8 months or 6 to 8 months. That cost is like nothing to them. And so it all just kind of depends on how much someone, in those cases, someone cares about the speed. When you're talking about, oh, you've got a really difficult bite, that really convinced them because there's not really an option. No, most people don't want to be going through 4 rounds of aligners for 4 years.
So you don't give you the option not to use it.
Yeah, where those really difficult cases, it's a lot harder. Even if there are some difficult cases that we have where it is still optional, where we highly recommend it, and they're like, why would I? And I'm like, well, this is like just ensuring that you have the most efficient time in treatment possible.
Perfect, thank you.
Of course.